This video is to clarify some questions about the mandibular anterior surfaces towards you. We want to discuss two different positioning options for towards surfaces. One option is to sit at 8 o'clock, and that's where I'm sitting now. Depending on your arm length, your 8 o'clock may be where I am. It might be pushed back a little bit, or it may be pushed a little bit back more, depending on how long your arm is. The other option is a 9 o'clock position, where you want your belly button toward the ear of the patient, and this would be the 9 o'clock position. The other thing we need to remember is that our patient's chin will always be down for the mandibular anteriors, and then as you start, you would start on the canine furthest away from you with your patient turned toward you. As you work across the anteriors, your patient's head will be turning away from you as you work toward you. Now, what we're going to do next is talk about preparing for your actual assessment stroke. What you would do next is hold your instrument in a modified pen grasp, and what we'd like to see you do is to take your instrument and pull it up right behind this knuckle. That will allow you to stand up on your fulcrum in order to reach where you need to reach. The next thing that you're going to do is take your fulcrum finger and extend it ahead of the other fingers in your grasp. And we practice this in class, and you've seen it on your clinic key video. This is very important because you have all this extra length in this particular explorer, so you need to extend that fulcrum finger. The next thing that you're going to do is you're going to actually take your palm and turn it down. So you can see your palm is pointing down toward the floor. Then the last thing you're going to do is go ahead and place your fulcrum. I'm working on the canine here first, so my patient will be turned way toward me. And I will place my fulcrum here, stand up on my fulcrum. I will insert underneath the tissue, and I will walk and roll my instrument to keep my tip adapted to the tooth. Again, as I'm working across, I will reach up and turn my patient. I will fulcrum again, my fulcrum extended, and I will insert and I'll walk across into the interproximal area, and again turn my patient and continue all the way to the canine.